Birth control making its 50-year mark.
From the basic pill to other forms to even what it can do for a woman's body. Here's a look at where it came from to where it is right now. "12 million women take oral contraceptives for many different reasons."
First was control for their own reproductive chances to determine when they were going to be ready to have a child. The second was all kinds of women take the pill for the purposes of suppressing cysts, for regulating cycles, and we didn't have a good plan for those women, so it was a major clinical advantage for doctors at that point.
Plus, patients can determine what kind of cycle they have, which can be a big deal socially. Though the pill has evolved a lot over the past 50 years, the ingredients have stayed the same.
The most important difference that's happened with the pill is the amount of estrogen that's changed since the pill first came out to today. Even though the type of estrogen is the same, the quantity, which used to be what we would say would be about 80 milligrams, is now down to about 20. So the amount of estrogen and some of the concerns that people had with estrogen in the pill is dramatically different because of the amount of estrogen.
Dr. Dunn explains progesterone is the second component in the pill,
which is the second part of the pill. It's what keeps women from bleeding. It's that hormone that stabilizes the lining. That is totally different now. Those types of molecules weren't even known at the time the pill first came out.
Makers of the pill figured out this new type of progesterone helped with common problems like acne and weight gain that used to be associated with oral contraceptives. They also realized that lowering the amount of estrogen helps alleviate other annoying problems.
Which helps, especially some sensations like bloating, abdominal pressure, breast engorgement, things that some women didn't like. And the other is the second hormone called progesterone, which is so different today that it binds more specifically to what are called the receptors for that hormone. So its action is more unique for that hormone than it's ever been before.
One last big difference in the pill?
And now instead of 7 fake days, they've now decreased the placebos or sugar pills to just 4. Because we know that if you do it a little longer, it lowers the subsequent cycle's chance for failure as a contraceptive, because they haven't been on as many estrogen-free days. That was one of the problems with the earlier pill.
So what do these advancements of the birth control pill mean for women who are looking to get pregnant? Dr. Robert Anding is an OBGYN for Obstetrical and Gynecological Associates in Houston. His specialty is reproductive surgery. We're so glad that you are here with us this morning. And we have so much to even learn about it. You think that you know everything, but when we start talking about the facts about the pill, it's really quite interesting. I think one of the most interesting things is the fact that it can help a woman's health. How is that so?
Well, absolutely. We've gone through a lot of generations of pills. As the prior interviewee was talking about, the pills have gotten much, much lower in dose, and so that provides a much higher level of safety, particularly in terms of some of the complications that can rarely occur on the birth control pills, such as blood clots and accelerating heart disease. In terms of the safety and well-being, the pills have become much, much lower dose so that they're regulating the cycles and they're making periods lighter, shorter, more predictable, and the pills have, as I mentioned before, fewer side effects. And there are health benefits. And some of those are, we do know that if a woman is on a low-dose birth control pill for at least 6 months, she's going to decrease her lifelong risk of both ovarian and uterine cancer. If she's on a birth control pill for 6 years, she can reduce the risk of both those cancers, both ovarian and uterine cancer, by 60%.
That is a huge deal considering those can be very terminal cancers. Sometimes they're caught late stage because there aren't many signs for it. So we want to reduce those risks in any way that we can.
Exactly. The ovarian cancer is kind of the nemesis of the gynecologist because it is somewhat difficult to detect. We don't catch it generally on the earliest stages. It has to advance before we do. So that to reduce the overall risk lifelong is very important. So we should be seeing less of that.
A lot of women used to be really concerned because there was so much estrogen in the pill. We heard Dr. Dunn say a few moments ago that they have really reduced that amount from 80 milligrams down to 20. Is that what's helping the new change that's lowering the risk of cancer?
I don't know if it's really the reduced risk. I know the pills are they're more easily taken with fewer side effects, so more women are relying on those for longer periods of time. And so we've accumulated data over the years. And the information that I just spoke about are really what's come out in the last 20 years. And in that time, the estrogen content of the birth control pill has been reduced, like you said, from 80 to 50. And really, in the last 20 years, we've only used pills primarily with 35 down to 20 micrograms of estrogen.
You mentioned earlier the blood clotting, and that always is a big concern. But again, is that somebody who is smoking or someone who's diabetic that has to worry about that more than just the typical woman who's popping the pill?
Absolutely. Diabetes, hypertension, smokers, history of cardiovascular disease or clots, then yes, those are things that are compounded perhaps by the higher dose pills. They're significantly, those risks are reduced with the lower dose pills, even to the extent that we're using birth control pills in light of some of these diseases with a higher level of caution.
Do you think that the pill can help people who are looking for other things? Like you hear all of these different commercials of, you know, it's going to reduce your acne, or this has iron in it so you won't become anemic. Is that really helpful to women, and do they need to talk to their doctor about different types of the pill?
Well, most birth control pills on the market today are a combination of both estrogens and progesterones, and it's the estrogens that help to reduce the acne, and so that is something that's true. And most pills will give you some level of reduction in the acne. In terms of, a lot of times we use birth control pills in women who are not sexually active just to regulate their cycles. Many women come to me on a regular basis saying, my periods are so heavy I can't leave the house, and I'm staining my clothes and having different problems. And so that with a birth control pill, you're going to significantly reduce the amount of blood loss with each cycle, and thus reducing the risk of anemia.
On the other hand, something fascinating about the pill is the fact that reproductive specialists use it on a regular basis to help women get pregnant. It gets them all regulated?
Right. They're staging. They're setting the stage for their reproductive activities. It down-regulates the birth control pill. Birth control pills work through the central nervous system, through the brain, and it kind of fools the body into telling the ovaries, we don't need you, we've already got enough estrogen, we've got enough progesterone, so you don't need to provide these things. And so it makes the ovaries very quiet. So when the reproductive medicine doctors give you medicines to stimulate the ovaries, they respond very well.
Dr. Anding, a lot of our chatters online right now are really intrigued by what you have to say, and we have my tech guy, Doug Deloney, standing by. Doug, do you have a question for us?
Yes, one of our chatters, a female named Fish, says she was sterilized after her second baby because of some major deformities, but found out that it was actually the medications that caused it. So can it be reversed is what she wants to know. So I don't know if the doctor has any insight on that.
Sterilized, would that mean tubes tied, or what do you think she's talking about?
Yes, she's had her tubes tied, and a lot of people do, and then they regret it and come back, and yes, they can be reversed. It is something that I do, as well as several other doctors in town. It is a microscopic, prolonged procedure. The results usually are very good. You can usually establish, the national statistics are, with a good procedure, a good technique, you can reestablish patency about 80% of the time, meaning that we get a good result and the fallopian tubes are repaired and open.
Once they get that repair, how quickly can they get pregnant usually after that? I know it certainly varies with every couple, but...
Well, the tubes heal very rapidly, and so that usually once we make the repair and let the incisions and the effects of the surgery heal, that's usually about 2 months, and the tubes are fine, and we go ahead and tell our patients to go ahead and try.
Very interesting. All right, Dr. Anding, thanks for coming over from OB/GYN Associates. Appreciate you being here. Great information.
Well, thank you.
Hopefully our viewers learned a lot today from you.
My pleasure.